Thanks very much for everyone here today, and thanks for being on the phone lines for everyone here as well. Premier Moe will have an opening statement followed by a brief update by Dr. Shahab, the Chief Medical Health Officer for Saskatchewan, on the number of cases today in Saskatchewan. Premier Moe.
Well, thank you everyone for being here today. Today I have two very different announcements to make. One is ensuring that Saskatchewan people have the financial support that they need to get through this difficult time, and that we all have jobs to go back to once this is over. The other is about further restrictions that we are ordering to protect the health and the safety of Saskatchewan people and Saskatchewan families. So let me first start with our financial support plan. As I said the other day, our government's goal is to dovetail with the federal government's very comprehensive financial support plan that was announced earlier this week. Our plan is to support businesses and to support employees. And most importantly, it supports the opportunity to come back to work when we emerge from the COVID-19 crisis. So today we are announcing a number of mechanisms of reducing costs for businesses and individuals, as well as providing supports to self-employed individuals not covered by the new federal support measures. A new self-isolation support program has been created. Administered by the Ministry of Finance, this program will provide $450 per week for a maximum of 2 weeks, or $900 in total. This program is targeted at Saskatchewan residents forced to self-isolate that are not covered by recent federally announced employment insurance programs and other supports that are available. This program is designed to ensure that all Saskatchewan residents are covered by either a federal or a provincial program. And this will ensure that no one is faced with choosing to work instead of protecting their family and their community from COVID-19 by self-isolating. And it will predominantly apply to those self-employed residents of Saskatchewan. This program will be an anticipated investment of $10 million, and the full criteria and the application information will be posted on saskatchewan.ca COVID-19 on Monday, March the 23rd. We're also making changes to ensure businesses and individuals are able to free up as much financial resources as possible. So effective immediately, Saskatchewan businesses will be able to defer their PST remittance to immediately alleviate cash flow concerns. Over the course of this 3-month program, government estimates a potential deferral of up to $750 million in PST collections. Audit programs and compliance activities, they have been suspended to allow businesses time to focus on the health and the safety of their customers and their staff, to reduce the impacts to their business operations, and also to minimize the spread of the virus through reduced audit travel. The Crown Utility Interest Deferral Program is waiving interest on late bill payments for up to 6 months, and that was announced earlier this week. And it will be made available to all Crown Utility customers. And effective immediately, a 6-month student loan repayment moratorium has been put in place, mirroring a similar federal provision that was put forward earlier this week. This provides individuals with student loans immediate relief, and it comes with a provincial investment of about $4 million. We have heard concerns from businesses that have been unable to provide temporary layoffs to their employees to allow these individuals to access a newly formed federal programs. So in addition to the changes made to the Saskatchewan Employment Act that introduced a new unpaid public health emergency leave and removed the 13-week employment requirement to access sick leave and the requirement for a doctor's note to access sick leave, the employment standards regulations have been amended to do the following. To ensure that during a public emergency, businesses will not have to provide notice or pay in lieu of notice when they lay off staff for a period of 12 weeks or less in a 16-week period. And if an employer lays off employees periodically for a total of more than 12 weeks in a 16-week period, the employees are considered to be terminated and are entitled to a pay instead of a notice as outlined in the Act. This will be calculated from the date on which the employee was laid off. These amendments create a balance for employers and employees where the difficult decision may be made to temporarily lay off employees due to public health emergencies. And in this circumstance, employees would have immediate access to new federal employment insurance programs, while keeping employers financially stable to ensure that employees have a job to return to. And lastly, in regards to the economic measures that we are taking here today to provide support to Saskatchewan businesses seeking to navigate the uncertain conditions that have been caused by COVID-19. The Government of Saskatchewan will be establishing a single window information webpage for businesses to access information and receive timely updates on provincial support initiatives. This will be complemented by the establishment of a business response team led by the Ministry of Trade, Export and Development, which will be a single point of contact for businesses to identify programs, supports relevant to their particular industry. Once the business response team has been established, contact information will be provided on the Government of Saskatchewan COVID-19 website. As well, it will be communicated to the public and to the local chambers of commerce for dissemination to their chamber membership. Today, the Government of Saskatchewan, on the direction of the Chief Medical Health Officer, is also imposing a number of new restrictions. So effective immediately, public gatherings are now limited to no more than 25 people. Nightclubs, bars, and lounges must be closed. Effective on Monday, restaurants are required to close except for takeout and delivery services. Personal services such as hair salons are also ordered to close. Dental, optometrist, chiropractic, podiatry clinics are also ordered to close except when offering non-elective procedures. Daycare facilities are limited to 8 children unless they are able to configure to no more than 8 children per room. But most importantly, each and all of these orders are now mandatory, including the requirement to self-isolate after returning from foreign travel. Today, I signed an emergency order that all persons are required to comply with all orders issued by the Government of Saskatchewan and the Chief Medical Health Officer, and that all police forces in Saskatchewan are authorized to take any reasonable action, including the power of arrest, to enforce these orders. This means that the full weight of the law and the law enforcement agencies are being placed behind these orders under the provincial state of emergency. And I know, we all know, that the vast majority of Saskatchewan people are taking their personal responsibility very seriously and they are following these orders. But there are a few who are not. And I am particularly concerned about some of those who are returning from foreign travel and are choosing to not self-isolate. Most of the COVID-19 cases in Saskatchewan and most of the COVID-19 cases across Canada are due to and related to foreign travel. In fact, 5 of the 6 new cases that have been identified today have also been traced to foreign travel. If we are able to reduce this threat, we will be able to flatten the curve. But this is not a suggestion. It's not a guideline. It is now the law. So when you return to Canada, you must go home immediately, and you must self-isolate for 2 weeks. This doesn't mean that you go to the grocery store, or go to the drugstore, or go fill up with gas and then you go home and self-isolate. This means you go home, and you stay home, now. And if you don't do this, you are now breaking the law. Again, I know that the overwhelming majority of Saskatchewan people are following these orders, and I want to expressly say thank you for doing that. These are the measures that are necessary for us to flatten the curve of COVID-19. These are the measures that are necessary for us to reduce the risk to protect our families, to protect our neighbors, and to protect our friends. But this doesn't work if most of us do it. We all have to. We owe it to one another.
Dr. Shahab?
I'd just like to add, like the Premier said, I think this is a very narrow and rapidly closing window of opportunity that we have to really try to prevent as much as we can any local transmission. We know it will happen, but I think we really need to make sure that potential opportunities are minimized. So hence the emphasis on self-isolating if you have come back, if you were a close contact of a case, and of course further restrictions on gatherings, because we also know that not so much in Saskatchewan, but in other places involving people from Saskatchewan, there has been exposure in those kind of gatherings where you may be less than 2 meters apart, maybe handing things either at a sporting event or at a social event. So the time is now to really try to just calm everything down, see where we are in 2 weeks, and then keep reassessing at 2-week periods to make sure as much as we can that we maintain the curve as flat as possible.
We'll now have time for questions. Arthur?
Can you be a little bit more specific about what kind of consequences people might face if they were to violate these orders? You talked about the power of arrest. Would there be any criminal sanctions available? How long could they be detained? What kind of financial penalties might they face?
So first and foremost, it would be our true hope that that would not be the case, that people that may not be in compliance upon being approached would very quickly come into compliance. The goal here is full compliance with the orders that Dr. Shahab has recommended and now that we have put into law under the Emergency Measures Act. So that is the goal. If we are to flatten the curve, these measures need to be taken and taken seriously. That being said, there will be and is in many cases penalties that would come into place. For example, if you were found to not be in compliance with the 14-day isolation order and you, after returning from international travel, there could be up to a $2,000 fine applied. That is one example. But as I say, first and foremost, it is our true hope and our true wish and our true expectation that these orders will be complied with, as this is what is necessary for us to flatten the curve. This is what is necessary for us to protect those that are most vulnerable to this virus in our society.
Does this apply, retroactively to people that may have already arrived from traveling, or is it only new arrivals?
So what this would apply to is anyone that is under self-isolation. So and to anyone that has returned to the province in the last 14 days. So if you have been under self-isolation or returned to the province 5 days ago, you would have to be under self-isolation for 9 days. If you are returning to the province today, you would be under self-isolation for 14 days, and it would apply to anything that's occurring now.
You talked about a few reports of people not following the orders now. How many such reports and where are they coming from?
And most of what I've heard has been anecdotal. I don't know if you would like to speak to that, Minister Ryder or Dr. Shahab.
I would say the same. Most of what we've heard has been somewhat anecdotal, but it's concerning. The fact that anybody wouldn't take this seriously. We need people to recognize how serious this is, and we think this should certainly grab their attention.
Steph?
The City of Regina has passed its own declaration of state of emergency, limiting, saying that bars and restaurants are supposed to close immediately and limiting public gatherings to no more than 5 people. Your numbers are different now. How concerned are you that there might be a bit of confusion for people in the public, given the fact that there's kind of 2 different numbers floating around for how many people can be gathering and what should they be doing? I don't know who wants to take that one.
Well, I'll let Dr. Shahab go, and then I will speak to what the law of the province is.
Yeah. I mean, I've been saying for several days now that I personally avoid crowds where I can't maintain a 2-meter separation. So the 25 number seemed to be reasonable, that even if there was a meeting in a room, private or public, you could conceivably easily maintain the 2-meter separation. We also know that, with the weather changing outdoors, that may be easier. So you're right, 25 is less than 50. It's a number that seems to be reasonable right now, but the general principles are when we gather, we should minimize contact among ourselves, among families, socially, and really remain as isolated within our households as possible. And at work, we need to work very differently, maintain that at least 2-meter separation at work, careful hand hygiene. I think that is the new normal we need to maintain.
With respect to what's been going on today within Regina or other municipalities, I haven't had the opportunity to look at specifically what they're discussing there. This is what the province is putting forward today, and we're using the full weight of the Emergencies Measures Act to bring this into law in the province.
Having said that, I mean, who should people in the city of Regina listen to? Should they listen to what is coming out of their local council saying no more than 5 people? Should they listen to the province saying no more than 25 people with 2-meter separation? Like, just for clarity's sake.
Yeah, we need to. I don't know what authority they've passed their motions under, or whether they've been approved, and I just don't know what authority they've passed their motions under. So we have to check that. I know what authority these motions have been passed under. These motions do carry the full weight of the law in the province of Saskatchewan. So the people in not just Regina but across the province should be taking an eye to the recommendations of Dr. Shahab, as they are now the law of the province. We will look at what the city of Regina has done, and with respect to what act or what they are using to put forward the motions that they have had. I haven't had an opportunity to look at it.
Minister Wright or Dr. Shahab, what update, if any, can you provide about the number of doctors who may be in self-isolation because of that, their attendance of that curling bonspiel in Edmonton? I know you weren't able to provide those figures yesterday. Any update?
Yeah, also that, all I know is that Alberta, which is leading the investigation, mentioned about 72 people who attended the event and about 45 who attended a banquet. And I know that jurisdictions in Saskatchewan have been notified of people who were from Saskatchewan, but I have not received a summary report. But I do know that there are several healthcare providers, of course, at least one who is confirmed positive, several who are in isolation, a few who have mild symptoms and are being tested. But we should be able to provide a full summary over the weekend or by Monday.
We're going to go to the phone lines for a question. Operator, do you have a question on the lines?
We have Roberta Bell with Global Regina.
Hi, I had a question regarding airlines. I heard that the passengers that were on the Sunwing flight have still not been contacted by public health, and I heard that Sunwing only found out about this through the media. What is the procedure that Saskatchewan's taking when it finds out about a case for notifying airline passengers, crews, and people who might be affected by COVID-19?
Yeah, thank you very much. We are going to be posting, starting immediately, the airline and seat rows, the 7 rows that are impacted online, because the delays have been due to getting flight manifests that does take a few days. And so we will be proceeding like a few other provinces of immediately post once we, because we have to realize once someone travels, it may be 2-3 days or longer till someone presents with symptoms, gets tested. Once someone gets tested, the interview and contact tracing confirms whether you were asymptomatic or symptomatic while traveling. If you're asymptomatic, there is no need to notify the airline passengers. If you were symptomatic, even mildly, as a precaution, that notification is done. Initially, when there were a few cases, that was done through getting the manifest and sorting out who was sitting where. But now several provinces, including Saskatchewan, we will be immediately, as soon as we become aware, we will post the airline number and rows on our website. We are urging the federal government actually to post those centrally, because some airlines like WestJet are making their own postings. We think it's most efficient if anyone who's traveled can just go and check a central site, see which flight they came on, and see if they were on that flight at all or on those rows. But certainly that is a challenge not for us but for many jurisdictions, because as we discussed, people returning has increased dramatically through by air and through land routes. A few of our cases, 2 of our cases at least, drove back from the U.S. and became symptomatic after coming back. So again, it's a challenge in terms of the volume of people coming back, and so we have to streamline the notification both for people who were in aircraft and otherwise.
Adriana?
I would just, if I could add to that, on that question with people returning from international travel, which is a large part of what we're bringing forward here today, is the absolute need to self-isolate. This is by far and away the largest transmission of COVID-19, and the largest source of bringing COVID-19 not only into Saskatchewan but into Canada is international travel. And so I think it's fair to say, as you return to Saskatchewan, you should let me preface this with we aren't going to prevent the exposure to COVID-19. What we are trying to do is to flatten that curve and to lengthen the time that the general population is exposed to COVID-19 so that our healthcare facilities can handle the effects of the general population with respect to that. We are going to be exposed to COVID-19 by far and away, each and every one of us, over the course of, let's say, the next year. International travel, when you are returning from international travel, you should, for all intents and purposes, act like you have been exposed to COVID-19 and self-isolate for 14 days. By far and away, the symptoms for most of us are mild to asymptomatic, as the doctor says. If you do have those symptoms, you can call the 811 health line and request a test. But what we are saying is you should, for all intents and purposes, when returning from international travel, take the same precautions that you would if you had been exposed to COVID-19 by self-isolating. That is very, very important. It is the way that we are going to be able to flatten the curve. And when you look at the cases in Saskatchewan, I believe it's all but 2 of them have been directly linked to international travel. This is the source of COVID-19 in our province.
Adriana?
Just to follow up on that specific one, all but 2. So do we have community transmission now that we can't prove there's a link to travel into?
So out of 26, there is only one outstanding investigation where we are still searching for a possible exposure.
Okay.
And if we do not find that in another day or 2, then we will have to admit that this could have been community transmission.
Okay. And on that, so when you refer to the law, does that count for people who are returning from outside of the province? Like, as you said, some of the cases have been linked to Alberta. So people who weren't told to self-isolate because they got home from a trip to Alberta, does that apply to them?
I think the reality is actually, and this is my own view, is that there's a right of considerations why this rule has been applied for international travel, because that you can apply as it's a jurisdiction of borders. But if you look at risk, you are right that there are several jurisdictions in Canada that have increasing cases. Attending any large gathering, certainly we have seen transmission 2 weeks ago in Saskatchewan from people attending a large international conference. Those have ended. We have seen this week a smaller gathering, 70, 80 people, and there's been transmission in that smaller gathering. So even if you've traveled within Canada, it's important to be aware of where you've traveled. If you've just driven and met, your family member and everyone was fine, that's obviously a lower risk. If you have been to a sporting event or a gathering or a cultural festival, a wedding, where there are lots of people from other parts of Canada or even internationally, that's a risk. And now, you will note in the update to the order that there was a section that said no gatherings of 50 people if people have traveled internationally. That has become redundant because now anyone who travels internationally should not go to a gathering of even 50. So I think it's an evolving situation. It is challenging, obviously, for people who are coming back internationally who may have been coming for an event. But certainly if you've traveled from other parts within Canada, I think we're all aware where transmissions are increasing, and we need to be aware, even if we travel back, what were we doing there and what our risk is. And finally, the Premier said about the 2-week isolation. We have to remember that we've done 3,000 tests. The positive thing is we've done around 3,000 tests, 26 positive. So the test positivity rate is very low. But we also now understand that for the vast majority now, if you get a cough, dry cough, 2 or 3 days after travel, is it just because you were in a long flights, which many of us do get a dry cough, or was it COVID-19? If you don't have fever and you stay home 2 weeks, there's no concern. You really don't need to get tested, because the vast majority is a dry cough. It's not COVID-19, but even if it is, and the dry cough stays for a few days and goes away, there's no fever, there's no concern, because your management would not change now. Irrespective of whether you test positive or negative, you stay home for 2 weeks, and with a mild dry cough clears itself in a few days. But of course, if you have traveled and you get a fever, it's a good idea to call Healthline, be assessed, and if it's, your test is positive, you may need to stay for a bit longer till your fever is gone. But a lot of that need to test just because you have a dry cough really has gone away, as long as you remain on self-isolation.
Wayne?
How would that apply legally to people who traveled to out of province, like the law?
The law, the recommendation is to not travel out of province, as we said last week. The law is applied to international travel.
Okay.
Wayne?
Just clarify the labor law and what you're doing for employers who are forced to lay off their employees. I'm not quite clear what the current terms were and what the new ones are. I understood before you had to pay them out a couple of months' pay, and now you don't. Is that what's going on?
We've extended the time period so that employers can provide a temporary layoff for a longer period of time, which will allow employees to access some of the enhanced federal EI benefits that have been put forward. They've shrunk the wait time, allowed people to access EI when they are staying home to take care of a child, for example, staying home to take care of someone who does have COVID-19, or staying home because they actually have COVID-19 themselves, or self-isolating. And what we've done is allow those the temporary layoff. We've expanded the temporary layoff ability so that employees can actually access the federal program. And in addition to that, then we've supplemented that with the provincial program, the self-isolation support program, for the most part, not only though, for the most part for self-employed people like the Uber driver, like the hairstylist, if you will, that is a one-person self-employed organization, doesn't pay into EI, needs to self-isolate for a period of time, can't access the federal programs because they aren't yet sick, but they are self-isolating. Once they would actually be tested positive for COVID-19, they would be able to access the federal program. But in that period we want to provide them every incentive to self-isolate. And so what we've done is dovetail in on the federal program to really make the federal program as accessible as possible for employees, but also fill some of the gaps provincially that maybe the federal program didn't quite grab.
Some employers have been sending us notes saying, well, if I lay off my staff, I have to pay out $45,000 in payroll. Is that what was going on?
Well, that would be if there was a permanent layoff. Now they will have the option for a temporary layoff to find our way through the next however long, understanding that some businesses won't be generating a lot of revenues. Some may even be closing their doors. But then they will have the ability to bring these folks back, and they'll be able to access the federal or provincial support programs as employees and individuals in the meantime. And the employer is fiscally more fiscally stable, which will provide the opportunity for the employer to survive the next number of months and actually be able to pick up, carry on, and provide those jobs for the employees when we get through to the other side of this curve.
And you have something today as well for the laid-off hairstylist and for the laid-off waiter
That's the self-isolation support program, yes.
We're going to go to the phone lines for a question. Operator, do we have a question on the lines?
We have Guy Quinville with CBC. Go ahead, Guy.
Oh, I've been unmuted. Thank you. I guess I'm personally grappling with the language of today's release. Now you're saying it's mandatory for basically anyone coming back to Saskatchewan from any foreign point to self-isolate. Are you saying you've essentially been telling people to do that for days now. So are you setting a demarcation line for today where, what was different a few days ago? You were already encouraging people to do that. So is it correct to say you were merely advising and encouraging people to do that only a couple of days ago, whereas now, if you don't do that, you're going to be in serious legal trouble? I just want to be clear about what you're saying today.
What we are using today is the full weight of the Emergency Measures Act to put the full weight of the law, the provincial government, and the law behind the fact that if you are returning from international travel and you are choosing to not self-isolate, the police forces, municipal, provincial, or federal, the RCMP, will have the ability to ensure that you do self-isolate and ensure they can levy fines or conduct an arrest to ensure that happens. This is by far and away the largest source of COVID-19 infections in Saskatchewan. 14 days self-isolation does largely address this virus coming into Saskatchewan. It largely addresses us having the ability to flatten the curve in these early days. And we had I believe what was a recommendation to an order from the Chief Medical Health Officer, which also should be followed. But today, this has been elevated to the level of provincial law under the Emergency Measures Act.
Karen?
So just on that point then, police can't be everywhere, so are you expecting people to snitch on their neighbors and relatives?
No, I'm expecting people to comply. I truly am. This is the way that we are going to flatten the curve. This is the way we are going to protect our family members in our communities. This is the way we are going to protect those that are elderly in our communities. And this is the way that we are actually going to allow our health system the opportunity to deal with the COVID-19 outbreak over a course of many months rather than a short number of weeks.
Arthur?
In the scrum, just I believe yesterday, when we were here with the Chief Medical Health Officer, we heard first, and I think this is a direct quote, that you cannot police your way out of this. Mm-hmm. And further, that daycares are not an incubator of the disease. And now we're seeing, one, an attempt to use the police to deal with this problem, and two, further restrictions on daycares. So I'm just asking, why are we suddenly coming down with relatively heavy-handed measures just a day after we had expert opinion that they wouldn't be effective and that the risk in at least one case was fairly minimal?
So go ahead, Doctor.
So first of all, so there's been lots of changes over the last 2 weeks. As you know, about 2 or 3 weeks ago, if you're coming from some countries, you were actually put in quarantine by the federal government. If you're coming from certain cruise ships or some countries, if you were coming from other countries, you were mandated by the federal government to go in mandatory self-quarantine, which is the same as self-isolation, it's a different term. And then from the U.S. and other destinations which are perceived to be quote-unquote low risk, you were told to self-monitor for 2 weeks. So there's a lot of ambiguity. And then there was confusion about if you come from some countries, does self-isolation mean don't go anywhere? And then if you come from some other countries, does it mean, oh, you can go shopping, like the Premier said, or go and meet your friends? And so this removes that ambiguity. And it just levels the playing field. Everyone has to stay home for 2 weeks, get someone to do your groceries. And then the other main thing was that there was a lot of back and forth movement happening, which was people trying to have it the dry cough, saying maybe they should get tested. There's a lot of movement happening, which again is not really, you want to minimize that. So this just calms everything down. We hope that, there's not a lot of places to go to anyways. Things are, so the easiest thing for everyone who's traveled back is just stay home for 2 weeks. It just removes any ambiguity. And as you know, when you just come from a short holiday or from a longer trip to the south, it's different from coming back internationally. The perception is really that it's not such a big deal coming back. So I think I just wanted to emphasize that actually the risk really now doesn't matter wherever you come from. So that is the main message. As we see our cases, they are actually coming from sun destinations, they're coming from trips down south, and so we really have to observe the same process for the next little while till this settles down, and then we can reevaluate.
I would just add, with respect to all of a sudden potentially being heavy-handed, which I just don't accept that. The premise of that question, Arthur, with respect to closing schools in this province, that's a heavy-handed action that didn't come lightly by this government. We have made what I consider some very, very serious recommendations, some very serious decisions in consultation with Dr. Shahab, our Chief Medical Officer, and we'll continue to make those in the days ahead. And one of those is today, in not only making these recommendations, not only putting the weight of the Chief Medical Health Officer's order behind them, but putting the full weight of the law of Saskatchewan behind these.
Just one thing I just want to add. So we also, I reviewed 2 publications yesterday evening that also, one from the US, they've had several thousand cases. They've done a review of those cases. So they did confirm that children under the age of 20 are less likely to get serious illness. They reconfirmed all the things, but they can have very mild illness. So, and there's another publication in another journal which showed that although the percentage of children is low, they can have mild illness. And so that is another concern that obviously, daycares 8 and under can still go ahead with an adult supervisor. But you want to minimize the mixing among children and among adult supervisors as much as you can, because as things calm down, you want to minimize that as well.
And just follow up to move on to the financial aid package. There's a few things I don't see in the financial aid package. So there's no protection for people that may be facing eviction, which is something that the opposition has called for. I'm wondering why you didn't put that in. I'm also wondering about what happens to self-employed individuals who are out of work because of the state of the economy, the lack of demand, and further the oil industry, which is likely to be one of the most heavily affected industries. Why is there nothing specific for it in this package?
So I'll address each of those, and then more broadly, with respect to the energy industry, you are going to see some of the work of not only this province, the industry, as well as other provinces that are impacted by the energy industry and the federal government, quite likely in the days ahead. There are some pieces in this financial aid package here today that will have an impact not only on the oil industry, but on those that are employed in that industry and others, with some of the business impacts that are here. Self-employed people that have had to shut down their business or have lost their job due to COVID-19. There are some opportunities through this. There are some opportunities as well through some of the federal support program that are there, and we're going to continue to work with those in Saskatchewan, as we are going to and already are seeing the very serious effects of a slowdown in our economy. With respect to protecting those with addictions, that may still be part of the conversation with respect to, and speaks to the importance of tabling some of our investment intentions over the course of the next year, with what was our increase in mental health and addictions in the investment and spending intent we had in the budget the other day.
Total about $33 million.
$33 million increase there with respect to mental health and addictions.
I think I actually meant to say those who may be facing eviction.
Oh, eviction. Yes. Sorry, I don't hear very well. Those, we do have. There is opportunities that we do have for those that may be facing eviction, with respect to through social services with the social housing that we have. We have availability if someone is facing eviction. With respect to these supports that have been put in place, they are to prevent that. If you are able to forego the interest on your power bill for 6 months, as you're not able to pay that is going to provide you some dollars to pay some of the other expenses that you have. If you are a student that has a student loan payment, that is going to be addressed in this package. So those behind every person that is facing eviction, there is measures in this package that are going to affect their household income, are going to affect their opportunity to continue to pay their mortgage, to continue to pay the rent of where they are residing. This fits in line with the three-pronged effort that we had indicated we were going to take with respect to COVID-19, and the first of those was restrictions, and you're seeing more of those today, and you're seeing the restrictions that we have put forward having the full weight of the government of Saskatchewan and the law of the government of Saskatchewan behind it. You're also seeing now today the start of the resources that are being put forward, and by resources, there's resources that are being put forward into our our Ministry of Health to ensure that we are prepared to deal with the treatment of individuals as our COVID-19 cases increase, and we expect them to increase in the days, weeks, and months ahead. But you're also seeing the resources coming into play here today for those employers that are employing people in community after community in Saskatchewan to make things as seamless as possible. As yes, we are experiencing, like the rest of Canada in this slowdown, some layoffs, but we are seeing federal and provincial supports that are accessible by those employees, and you're seeing a streamlining to ensure that employees can access those supports for whatever reason that they may not be at work. And then you're also seeing the supports for people. The supports for people in the way of student loans being deferred. You're seeing supports with respect to Crown utility bills and the interest being deferred. You're seeing supports with respect to those that some minor gaps that may have occurred with the very comprehensive, I might add, federal package, that support program that was put forward just the other day. So this is starting to enter the second step, still have our eye on restrictions, but starting to enter the second step of providing resources to the people of the province.
Steph?
So what should somebody in Saskatchewan do if they know of someone's returned from foreign travel and isn't self-isolating for 14 days? What should they do?
They can phone their local police detachment.
You're asking people to call the police on others when they know they're not.
Should talk to them first.
Yeah, if they know them well enough, they should talk to them, and they should ask them why they're not self-isolating. But at the end of the day, whatever the local police detachment will be the entity that will enforce the law of the province in the same way they enforce any other law in the province. But as I have said earlier, it is truly my sincere hope that people will comply with this, and by far and away, the vast majority of people are complying with this. And I know many individually that are. And I'm certain that now with today's announcement that we will have virtually 100% compliance. It's my true hope.
We've got time for a few more questions. Going to go to the phone lines for one question. Operator, do we have a question on the line?
We have Murray Mandrick with the Leader Post. Go ahead, Murray.
Thanks very much. Two quick things. By international, I want to be crystal clear. That's everywhere, United States, all warm destinations. And secondly, the $10 million seems a bit light in the sense that that's 9,100 people by my rough calculations existing with the added measures today, significantly more people in restaurant, hair salon industries, barbershops, all would qualify. Will there be additional funds available if the take-up for programs like this and your other programs are swamping the current amount?
First question, yes, it's all international destinations. Second question is the $10 million is an estimate. The program is there and the resources will be provided as to what is requested and approved.
On the daycare thing, does that apply just to licensed or unlicensed as well? Some folks look after 8, 10 kids in their house, probably in their basement or whatever.
Yeah, it aligns reasonably well with the provincial regulations that we have. Applies to all.
To everybody.
Sorry.
Adriana?
Yeah, thanks. Well, on that note, the city of Regina announced the closure of all daycare centers. So how can they do that if you're saying that daycare centers can stay open with 8 children? And on that note, who gets to stay? I mean, you've announced the centers that are available for emergency service or essential services, but who gets to stay in the other daycare centers as we weed down to 8 kids?
So I'm not aware of what the City of Regina has done this afternoon and under what act they have moved their motions and what authority they are making their motions. So until I review that, I would say that the provincial regulations that we have put forward here today apply. And if anything's different, we will let everyone know as soon as possible, because I'm just not aware of what the City of Regina has been conducting, what act they're utilizing here today.
But with the like, who gets to stay in the centers in terms of the 8 kids?
Oh, well, it's 8 or 8 per room. So there may be a reduction in some of the daycares that are operating. And I believe if you have one in private daycares, if you have one daycare provider, one person, they can have up to 8, so it shouldn't impact those too greatly. And then with respect to some of the larger daycares, it would depend on how many rooms they have, and just, some encouragement around not bringing them all together for lunch and for playtime and things of that. The goal here is to have small groups that are separated from one another.
Now,
Karen, we have time for one last question.
It's okay.
just on the economic measures again, the PST deferral program, how will that affect municipal revenue sharing, or how do you predict that will affect it? And I guess, is it going to be enough for local businesses who have been ordered to close? And local businesses like bars and things and hair salons who've been ordered to close, I mean, $900 for 2 weeks probably isn't going to cover it.
Right. Well, those are two different programs. The PST deferral it won't affect the municipal revenue sharing in any way, shape, or form, as it's a deferral, not a removal. So it won't affect municipal revenue sharing in any way. We will cash flow it as a government. We're fortunate to be in a position where we're able to do that with the cash reserves that we have on hand. Will it be enough? Will it be enough for our Saskatchewan businesses to survive? That is a question that no one can answer. We are in an uncharted territory. I'm not aware of the last time this provincial act has been utilized. We are in uncharted territory as a province, as communities, and I would say as individuals. And there are